that we're just entering the HCG market, HCG into Goa market. So I'll just give you a little brief about our hospital, HCG Cancer Center Bangalore. HCG Cancer Center Bangalore has been leading the way in revolutionizing cancer care since its inception, providing patients with the best-in-class treatment. As India's largest network of cancer care hospitals, HCG is equipped with cutting-edge technology for the diagnosis and treatment of all forms of cancer under one roof. So we are thrilled to expand our services and bring world-class cancer care to the people of Goa. Once again, I would like to welcome you all to this press conference. I would like to invite Ms. Manisha Kumar, Chief Operating Officer Karnataka from Healthcare Global Enterprises Limited, to address the media.
Hi, good afternoon. Thank you so much for coming. So, I'm Manisha Kumar. I head our Karnataka set of hospitals from HCG Oncology. My colleagues Dr. Raghunath and Dr. Natraj joined us here. We represent Healthcare Global Oncology Hospitals. HCG actually, we run 23 tertiary and quaternary care oncology focused hospitals across the country. We are headquartered in Bangalore, which is where our center of excellence, our main hospital is, and that is where we all three of us are coming from to meet you all. HCG's way of treating cancer has been using cutting-edge latest technology and multidisciplinary approach with a multidisciplinary team of oncologists, of clinical experts to diagnose, to assess cancer, and then devise personalized treatment protocols for each of our patients that ensure not just correct treatment but also an enhanced quality of life post-treatment. We have oncologists, so very qualified, experienced oncologists who not just operate or give chemotherapy or do radiation, but also super specialize in specific organ cancers. So we understand that cancer is heterogeneous, it's very complex, it manifests differently in different people. So we have organ-specific teams of clinicians, of oncologists, who have for majority of their practicing career, have super specialized in a particular organ cancer treatment. I'll take an example of prostate cancer. So when I say multidisciplinary team of doctors, we have an onco surgeon, we have a medical oncologist, we have a radiation oncologist, we also have pathologists, radiologists, nuclear medicine experts, geneticists, who have all pretty much focused and super specialized in urological cancer treatment area. And they all sit together, discuss, deliberate, look at the profile of every patient, not just the diagnostic test results, but also the age of the patient, the stage of cancer, the genetic profile of patient, and so on, and then together cohesively come up with the treatment plan for that patient. And this is the unique approach with which we have treated more than 10 lakh patients successfully so far. We get patients from across the country, from various parts of the country. We get a lot of international patients also coming from Middle East, Africa, and we get patients from Goa as well. More than 100 patients, new patients per year is what we see in our Bangalore hospital alone coming from Goa. Which is why we were pursuing, and we have now tied up with the Goa Mediclaim insurance, meaning our hospital in Bangalore is now empaneled with the Mediclaim insurance scheme. This will give cashless treatment to all the patients. Of course, most of the citizens in Goa are covered. All the cancer patients coming from Goa will get cashless treatment at our facility. Comprehensive care across all modalities of cancer treatment, something I just mentioned about, and my colleagues will speak in more detail. We also will, in addition to just providing cashless treatment at our facility in Bangalore, will create better access for consultations and for, to a certain extent, diagnosis and primary consultations for patients in Goa, by having our oncologists visit here frequently. So we will have every week, once a week, we will have doctors from our main hospital in Bangalore, expert oncologists, They would come here and run consultations and see patients, advise and help in diagnosing and assessing. And if needed, the tertiary care treatment would be then delivered at our hospital in Bangalore. Our doctors will be coming, and we have tied up with Campal Clinic, which is here in Miramar in Panjan, and also Royal Hospital, which is in Madgaon. And every either Thursday or Friday, once a week, one of our oncologists will be here seeing the patients and consulting for them. So I mentioned about high-end treatment. Of course, we have full spectrum of oncology treatment, comprehensive care. Some of the very nuanced, innovative modalities, which we feel we have been, the first movers, market leaders, and we are one of the very few institutes in the world that do our robotic surgery. So we have probably the largest number of robotic onco surgeries in this part of the country so far have been done by our doctors in our hospital. We have cyber knife and adaptive radiotherapy, which is very high-end, precise radiation oncology treatment. We do bone marrow transplants, and we have done CAR T cell therapy also successfully on few patients with blood cancers. We also have a lot of innovative nuclear medicine therapies. So some of these innovative therapeutic areas is where we have tied up, and of course full spectrum comprehensive services are available at our hospital. With this, I will pass on to my doctor colleagues to talk more about the specialized treatment.
Thank you, Manisha. Very good evening to all of you. Welcome you all to this press meet. Without you, it's very difficult to convey what HCG is to people of Goa. Why we are coming here is very important, and through you, probably we can achieve that. Your patient from Goa can benefit from this expertise from HCG through you. So you play a major role. I thank you for coming here and taking all these things to your people. So I'm Dr. Raghunath, Director and Head of Urological Oncology and Robotic Surgery Program. Manisha Madam told about HCG. I would like to talk more about surgery and robotic surgery in particular. We are not just another cancer hospital with all, surgical oncology, medical oncology, and radiation oncology. In surgical oncology only, we have different verticals. I do only urological oncology. I will come to urological oncology at the end. We have head and neck oncology. Head and neck oncology means they deal only with head and neck cancers. We have hepatobiliary oncology. We have GI oncology. We have orthopedic oncology, gynae oncology. Like the different surgical verticals are there. And the beauty of this is every surgeon is trained with robotic surgery, and our robotic surgery is one of the highest numbers we are doing, at least in southern part of India. Why I'll tell you. And before that, ours is the only center to acquire the second robotic system in South India because of our volume. That speaks about our volumes. And every separate vertical in surgical oncology are doing and utilizing this robotic surgery. That robotic surgery, how it is going to transform the healthcare or patient outcome. Like we used to do open surgeries, but now open surgery, you all know, big cut will be there, big incision will be there, more blood loss, and patient will stay for 7, 8 days, 10 days. Now, even supra major surgeries, we are discharging on 1 day or 2nd day after surgery. The blood loss is significantly less. They recover fast. If you do surgery, robotic surgery today, they walk tomorrow, and day after tomorrow they can go home. And from last 2 years or 3 years, we have not transfused any blood to any of our surgeries where they have undergone robotic surgery. This is the beauty of robotic surgery. The surgery has transformed significantly with the advent of this robotic technology and robotic surgery. To do robotic surgery, you need specialists. Not every surgeon cannot do this. And when it comes to our department, we deal with only 5 cancers. Urological oncology means we deal only with 5 cancers. In that, we are further subspecializing in our department, where one doctor will take care of only prostate cancers, another doctor will take care of only kidney cancers, the another one will take care of only bladder cancer. This is required because every day new technologies will be coming, new treatment options are coming. If you don't further specialize in that, it's very difficult to give best outcomes. So we are obsessed about giving best outcomes at HCG Cancer Center. That's why we are deep diving into all these things. We are acquiring new technologies and we are training people. When it comes to training, it is not just HCG is a big cancer hospital where good surgeons are there. It is important to give training. Ours is the first hospital in Asia to get recognized by Royal College of Surgeons for this training program. Okay, and ours is the first center to be recognized by Intuitive Surgicals from USA, where they produce robotic equipments, but training is lacking. So ours is the first center. This speaks about our department and our hospital, not just into patient care, into training the next generation of people. So that's what we are practicing, and I request all of you to pass on this message, why we are coming to Goa, and in what way, if we collaborate with Goan government, in what way we can transform or better the outcomes of your patients. So I would like to talk about these things. Because of paucity of time, probably after my colleague speak, probably we can discuss one-to-one. And I request all of you to communicate all these things to the people of Goa. Thank you.
Thank you, Dr. Goan sir. I think you discussed about our hospital very elaborately and very nicely. Thank you, madam, for giving us this opportunity. And I would like to thank all the media colleagues here who are the sort of, what can I say, you are the people who can transform the society. You have the power. There are only very few people who have the power to transform the society. One is teachers, second is media, because you are the only two messengers who can give right thing or wrong thing to the people. So thank you for coming here, and then thanks for your time. So I am basically a hematologist, hemato-oncologist and transplant physician. That is basically I treat blood cancers and then other blood related diseases, and also I do bone marrow transplant, a stem cell transplant, and now we are also doing cell and gene therapy, that is CAR T cell therapy. So our aim as an hospital is to ensure that everybody gets a care that is required, number one, and everybody gets the care, the best care that is required, not just the care. See, it's very easy to get treatment. No, it's not difficult. Anybody can go to any hospital and get the treatment. Whether the treatment is the best. We don't want to do our best. We want to do the best that is laid out in the world. Means we have to be excelling far than the best that can be done in West. So there is nothing we lack what the West has got. So I think it's only the delivery of the best that is been lacking. I think that is where we excel in. So our department, to tell you, we are one of the first centers in South India to start the bone marrow transplant. We have done nearly about 800 plus bone marrow transplant in our department, and then we do transplants for across all the age, very small age to the very old age, because we have mechanisms to sort of reduce the side effects of chemotherapies, and then we involve more and more of targeted therapies, and then we nowadays do a lot of drug levels, everything to ensure that ensure that every patient gets the right dose of treatment and right way of treatment. For example, I'll tell you, maybe there are two people of the same weight, same height here, may not carry the same weight if it is put on their head. Like for example, if 100 kilo is put on two different people of same weight, they may not be able to carry the same length. So we assess every organ function and we ensure that the right treatment is given to the right patient and what they can tolerate. One of the major problem in cancer care is side effect management. And then we have been excelling in that to ensure that they don't develop much side effects. And then if they develop side effects, we mitigate to ensure that their quality of life is retained very well. And second most important thing is we do transplants for very complicated patients. Like I'll give you an example. I just discharged one patient who is from Maldives. He was a 23-year-old patient. He had leukemia, acute lymphoblastic leukemia, and he had thalassemia. Thalassemia from childhood, he was getting transfusion. And then he had no match. Otherwise, he would have died without the treatment. So he had a half-match father. Only a match for half-match father was there. So we did a lot of hard work and then looked for the best available donor. And then his father was the only best available donor, half-match donor. We did chemotherapy. We devised the chemotherapy in such a way that it will not cause harm to him. And then we did post-treatment modifications to ensure that the transplanted cells, even though they are half-matched, they sit there and they produce. And now he is discharged, and then he is sort of cured of two diseases. One is cancer and second is thalassemia. So this is, I think, he is the oldest patient in the world who has received, who has got leukemia and thalassemia together, and then who got a half-match transplant, and then who got successful, who got discharged. I think in another 2 weeks I'm going to discharge that patient. Similarly, I discharged about 3 weeks before one more patient from Sri Lanka. She was running around all over the country, including she had gone to Thailand, other places to get the transplant done. But everybody had refused her, even though she had a match sibling, because she was about 22-year-old. And then we took that we took that patient, and then we did lot of pre-transplant treatments for about 3 to 4 months. We ensured that she gets into the best shape, and then we did the transplant, and then now she's got discharged. I think next week she will go back to her hometown, Sri Lanka. She will be one of the oldest patients with thalassemia to undergo a transplant. So these are the things we are doing. I'm not just boasting myself what we are doing, but it is a very difficult hard work that everybody in the team is doing, and then we want to give the best for the patient, and then every patient who comes to the hospital, we ensure that they go through the tumor board. And then it is not just that, like for example, you take a patient of cancer patient you can take a cancer patient to 3 specialties. You can take the patient to a medical oncologist who gives chemotherapy. You can take patient to a radiation oncologist who gives the radiation, or you can take a patient to surgical oncologist who does the surgery. Lot of times the treatments are skewed upon which doctor sees the patient first. For example, if a medical oncologist sees, he tends to give chemo. If a surgical oncologist sees, he tends to cut the patient, do the surgery. If a radiation oncologist sees, he would tend to give the radiation. But that may not be the best for the patient. What may be the best? Maybe first give surgery, or first do surgery, or first do chemo, or first do radiation. But what we do is, we do a tumor board where all the 3 specialists sit and then fight between each other based on the evidence, based on the data, to ensure that the patient gets the best care. So ultimately, we want the outcomes which is matching the best. We want to be better than America's results. We don't want to be anything less than that. That is our target, and then we have been able to achieve. And then if you see our breast cancer survivals in America, it is about 87%, and we are reaching about 88.5%. So that is our long-term outcomes. So these outcomes will speak volumes than what I come and speak to you right here. So what I would what I would want to send the message is, number 1, we do treatment based on the latest available evidence, and we do treatment based on the latest available technology, and every patient goes through the tumor board so that they get the best care that is possible. And number 4, whatever that is new happening in America will happen in HCG without any much delay. So that is why we are one of the centers who are recognized from many governments across the world from where the patients do come. For example, CAR T-cell therapy, it is a very complicated treatment. So we do it in our hospital mainly for multiple myeloma, lymphoma and leukemia. There are only hardly very few centers do that, and then we are doing that. And then other most important thing that we are most strong is in genomics, where we do every patient's cancer, we assess for what are the gene mutations that are there, and then we target accordingly so that they get better outcomes. Then we don't lose any patients, many benefit that they can get with targeted treatment. And number 5, our strength is in clinical trials. We have lot of newer drugs which are being delivered for the patients, and in clinical trials, where patients who have failed every form of treatment, they do have some hope for the patients. So there is some chance. So we would like to tell to all the media colleagues here, and then to all the Goans, that if you reach HCG, you will get the best. There will be nothing less than the best in our hospital. Thank you.
We are now open for media questions if you have any.
In Goa, only consultation is there, or any other activities?
So for now, we are starting with consultation. Once a week, we'll have our oncologists be present in Goa, and we'll do OPDs. That's the plan.
Any package of this kind of thing? Other advance during advance?
Package, you mean billing at the hospital? So it's going to be cashless. for the patients because it will be fully covered by the insurance, Medicare. So it's not out-of-pocket expense for the patients. They don't have to pay and then go for reimbursement. They will have complete cashless credit facility. We will in turn reconcile and settle at the back end. Patient doesn't have to pay anything out of their pocket.
Do you have own insurance policy?
Of our own?
No.
No, we don't have insurance policy.
It is safe one more thing is the government hospital also do robotic surgery. So what is the speciality do you tell us to your hospital?
In all the government hospitals, you take even AIMS. I'm just giving you an example, AIMS. There is no dedicated uro-oncology department. Urology department is there. Urology means they treat stones, they treat everything. At our place, uro-oncology is developed. Meaning to say, there is a specialty, there is a department to treat only cancers of the urinary system. This is called a subspecialty in uro-oncology. That's being developed, it's almost 18 years old. Okay. Since 18 years, we have been doing only urological oncology. And we have developed teams to take care of single organs. That's how our outcomes are better. Just to give you an example, generally robotic surgery or for prostate cancer, people do not do robotic surgery if the patient age is more than 70-75 years. We have treated almost close to 25 patients more than 75 years of age because of our technology and the expertise available with our department. We'll be publishing that. So we are extending these indications to benefit more people, even if they are elderly people, because blood transfusion is not required. Their outcomes are better. Why we should not give that therapy or treatment or surgery? Okay. If you have any questions, please ask.
See, many a times when a person is diagnosed as a cancer patient, or he or his family or the patient's family scared of being after operating or that cancer will come again. How robotic surgery?
See, robotic surgery cannot cure stage 4 cancer. Okay, there is a separate counseling takes place apart from this treatment. We counsel them what is the stage of the disease. We don't do surgery or we don't give treatment unless surgery. If stage 4 cancer comes, there is no role for surgery. In such cases, we go for either hormone therapy or chemotherapy. There are so many other modalities. As my colleague said, there is a multidisciplinary tumor board meeting should be there. All the stakeholders will sit in front of the patient. We deliberate on that. What is the best treatment for this given patient? It is not just surgery, or he may not require radiotherapy. He may be better off with chemotherapy or some other treatments. So we discuss and we give a personalized treatment. That is what is important, and that brings the best outcomes.
So that can I just add to it? I think, ma'am, you asked about recurrence also.
Yeah.
So like Dr. Raghunath said very aptly, that because of giving precise treatment in the first instance itself, the chances of recurrence are significantly lower. So recurrence usually happened, I think both of them allude to this, is if instead of going for a specific targeted therapy in the first instance, patient went to see a surgical oncologist and he just operated, or he went to a medical oncologist and he just gave chemo, because they have a very single track mindset, a very silo way of functioning. But we don't work in silos, and because all specialists discuss, deliberate and make a cohesive plan, so the first treatment itself is very precise, and therefore our data also shows that recurrence is substantially lower in our patients.
One more important message I want to give. In cancer, first treatment is the best treatment. You do anything afterwards, it's only repair work. Repair work will usually rarely successful. So that is why we have to do the right way, best way in the first time.
Madam, you said about surgery under the Mediclaim now. So if they don't have, then
I mean, of course, if they are not covered by insurance, see, we have empanelments with all the insurance providers. Mediclaim, of course, is for Goa's citizens specifically. It's an initiative of, Goa state. But we have empanelments with all government insurances, GIPSA, as you know, and with all private insurances. So if people have their personal insurance policy or they have any other government insurance, we are empaneled, and in that case also they will get credit facility if they are not in Mediclaim but they have any of
When we talk about cancer things now, do you feel that still more need to aware about this?
Yes, of course. Awareness is key, and we take a lot of initiatives on our own, also with various state governments to create awareness. We do a lot of campaigns. We run preventive oncology screening packages in our hospital as well, where patients can come and we have a full body MRI scan. In fact, that we do. We are one of the 3 or 4 private centers in India doing a full body MRI. There's very few hospitals that do it, which is a full scan of body without any radiation, because it's MRI, magnetic resonance. So we do that. So we have preventive oncology packages as well, and we take steps to create awareness. Awareness is key in preventing, and otherwise definitely early diagnosis and better outcome.
That's very important. Since we are coming for the first time to Goa, probably subsequently we can even talk on all those things. How to prevent cancers.
Yeah.
Sometimes you may not be able to prevent. Okay, even many doctors will die of cancers. We cannot prevent sometimes. At least early detection. How can we detect them early? What are the tests we have to do? All those things probably we can do, and we can expand this program to government of Goa.
रघुनाथ सर,
Yes.
जो अभी आपने फैसिलिटी बताई ना, हमारे गोवा गवर्नमेंट के DDSY कनेक्ट है मणिपाल हॉस्पिटल, आपके यहाँ पे ऐसा कुछ प्रोविजन है क्या?
हमारे हुबली हॉस्पिटल, we have a hospital in Hubli. Good question. I should have mentioned it at the start. There is an HCG हुबली में भी हमारा HCG हॉस्पिटल है that treats cancer, जो कैंसर फोकस करता है. वहाँ पे दीनदयाल स्कीम का empanelment है. So DDSY patients can be treated in Hubli. Mediclaim empanelment in Bangalore. But same set of services are available. Of course, Bangalore बहुत बड़ा hospital है, हमारा center of excellence है. Hubli is size-wise smaller, but same set of comprehensive services, clinical experts, tumor board way of working in both the places.
Any mindset of this type of you are saying first. Any idea about that this hospital will be tied with state government scheme?
Yeah, our Hubli hospital is tied up with DDSY.
Bangalore is empaneled.
Bangalore side.
No, Bangalore is not empaneled. Our Hubli hospital is empaneled. It's LCG itself, part of our company.
Sir, HCG has got multiple centers.
Yeah.
In that, for Deen Dayal scheme, Hubli is nearby for the patients. So it is empaneled. And for Mediclaim, Bangalore is empaneled because more specialized treatment, which is required, like robotic surgery or a bone marrow transplant or a cyber knife, those things are empaneled in Bangalore because more experts are there. See, at the end of the day, it is not the, it is what our aim is to ensure that we give the best care to the patients. So those are very smart, like for example, robotic surgery. They will come for 3 to 4 days for the surgery, maybe they stay for a week. So in that, there are more expertise like Dr. Raghunath, who is there in Bangalore. So they can just come for robotic surgery and go back. But if anything, other primary treatment is required, chemotherapy or any other things, Hubli is nearby for the patient, so patient can go
Yeah,
there.
and we have, so in Hubli we have empanelment for radiation, medical, surgical, all modalities,
Yes.
for DDSY. So that is our HCG hospital, another one. In Karnataka, we operate currently 5 hospitals. We have 2 in Bangalore, 2 in Hubli, 1 in Gulbarga. And we are coming up with 2 more hospitals in Bangalore. So there we have multi-hospital presence within Karnataka. And totally we have 23 across India.
And all are cancer hospitals.
All are pure cancer hospital. I think in generally, I think 1 in 8 patients with cancer we have HCG treats.
Yeah, out of the private hospital
Yes,
treatment.
I think 1 in.
Before this, you did your own consultation.
Not in a systematic way. We have a lot of patients coming from Goa already, which is why we thought about partnering and empaneling with the scheme here. But we did not have medical claim empanelment yet. So this is the first time we will be giving cashless facility to patients here. So we are going to do frequent OPDs once a week. Our doctors were coming off and on. We did some engagements and we are getting patients already from there, from here, but to our center.
Without the mediclaim, how much cost goes for?
So it really depends. It's a very subjective case to case. It depends on which stage, which cancer, if it's multimodality or single. It varies. But I think people here don't need to worry about that. We take care.
Any more questions? We are happy to answer all your questions.